What flu risk should chronic disease patients know? Imagine facing the flu with an underlying health condition that can make the illness much more serious. People with chronic diseases are at a higher risk of severe complications from influenza. During recent flu seasons, nearly all adults hospitalized with the flu had at least one chronic health condition. This shows how much these illnesses can worsen flu outcomes. Conditions like heart disease, including heart failure and past strokes, significantly increase the risk. Flu can trigger heart attacks or strokes, and studies show that the chance of a heart attack can be up to 6 times higher within a week of catching the flu. About half of adults hospitalized with flu have heart disease. Diabetes, whether type 1 or type 2, also raises the risk. It can make flu symptoms worse and increase the likelihood of needing hospital care. Many people with diabetes also have other health issues like kidney or heart problems, which can further complicate flu recovery. Lung conditions such as asthma, chronic obstructive pulmonary disease, cystic fibrosis, and bronchitis make patients more vulnerable. These illnesses can lead to pneumonia or respiratory failure if the flu worsens. Obesity, considered a metabolic condition, is linked to more severe flu illness and complications. Neurological conditions like cerebral palsy or multiple sclerosis can also increase risk because they may affect breathing or immune response. High blood pressure often coexists with other chronic illnesses and is common among those hospitalized with flu. Older adults, especially those over 65, are at even greater risk because their immune systems weaken with age. They often have multiple chronic conditions that make flu more dangerous. Sadly, many people with chronic diseases do not get vaccinated as often as they should, which leaves them more vulnerable. The best way to protect yourself is through annual flu vaccination. It is the most effective method to prevent infection and reduce the chance of severe complications. Vaccination also helps prevent the worsening of underlying health issues caused by the flu. If you develop symptoms, seeking prompt antiviral treatment can lessen the severity and prevent complications. Practicing good hygiene like washing hands frequently, avoiding contact with sick people, covering coughs and sneezes, and keeping your environment clean are simple but effective measures. If you have a chronic condition and start feeling sick, it's important to see your healthcare provider early to manage your risks properly. Remember, having a chronic disease means your health status makes you more susceptible to serious flu outcomes like hospitalization, worsening of your condition, or even death. Taking preventive steps, getting vaccinated, and seeking early treatment are your best defenses. Always consult your healthcare professional for personalized advice and stay informed with trusted health sources.